Welcome to another MedTech Gurus podcast, where we meet and discuss trending and educational topics that are important to today's medical technology sales and marketing professionals. Now, it doesn't matter if you're new to the space or if you're a seasoned medical sales and marketing professional. You all have come to the right place. You see, the medical technology world is ever-changing, and MedTech Gurus will help you stay up to date by interviewing experts and opinion leaders. Now, we call them gurus, and they will bring you information, techniques, and strategies that are sure to help you enhance your knowledge and help you bring value to your customers and your company. Now, I'm Sylvester Harris, and I'm pleased to introduce your host for MedTech Gurus, Mr. Tom Hickey.
Hey, what's going on out there, Gurus? This is Tom Hickey, your host of MedTech Gurus, and welcome to episode number 288. What if the key to reducing ICU infections, saving cost, and restoring patient dignity lay in rethinking something as overlooked as a catheter? In today's episode, Frank Gehres, CEO of Advanced Medical Balloons, shows us how his team is revolutionizing critical care with next-gen balloon technology. From tackling infection-prone ICU environments to pioneering low-pressure, high-seal solutions, Frank reveals how innovation can emerge from even the most ignored corners of healthcare. We'll explore clinical wins, hospital adoption strategies, and how to build a mission-driven culture around solving real-world problems. You're going to love the insights that Frank brings into this episode. But before we get into the episode, let's thank our sponsor, Accelerant Consulting. Gurus, the U.S. healthcare delivery system is focused on value more than ever. With that, value analysis teams have become increasingly influential in product decision-making. Here's the problem. How do you help your product stand out to the individuals in the value analysis committee? Let's face it, if they have to come back and ask questions, that can set you back months before you get back on their agenda. How much would that cost you? Let the team at Accelerant Consulting help. They can review or even design your value analysis documents, the result being having a complete document that resonates with the professionals on these teams. Reach out to the experts at Accelerant Consulting today. Check them out at accelerantconsulting.com. That's EXCELERANT consulting.com, and do it today. Okay, Gurus, here it comes, episode number 288. And remember, if you like what you hear, please subscribe, leave a review, and most importantly, tell a friend. Welcome, MedTech Gurus. Today we have an outstanding guest with us. Frank Gehres, CEO of Advanced Medical Balloons, joins us today to share insights into how his company is pushing the boundaries of medical balloon technology to improve patient care and surgical outcomes. Advanced Medical Balloons is at the forefront of innovation, developing next-generation, high-performance balloon catheters for a wide range of medical applications. Their cutting-edge materials and design advancements are opening new possibilities in minimally invasive procedures, diagnostics, and targeted drug delivery. Frank brings a wealth of leadership experience, having successfully led teams in medical device innovation and commercialization, and today he'll share his insights on navigating hospital access barriers and fostering a culture of innovation and the future of medical balloon technology. Hey, Frank, are you ready to be our guru today?
Yes, I am, Tom. Thanks very much for having me. It's a great honor to be on your show.
Thank you. We're very excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Yeah, thanks. Well, if I'm asked to introduce myself, I always, of course, start with, I'm a father of four. I'm the husband of a wonderful wife called Lisa, and I'm a CEO in the MedTech industry, right? But at the same time, in my spare time, I'm the assistant of my wife's art business. So my wife, Lisa, is a renowned contemporary painter in Munich, and I do all of the admin work in the background. So I support her business in my free time, and you know what? I deeply enjoy that because one, it's not about me. Two, it's about a business I have very little understanding. I'm not creative whatsoever, so I'm always enjoying the space of creativity, love the space of artists and art producers, and it's a very different environment. So I really love that. It's a lot of fun to do this in my free time in the background.
Oh, that's fantastic. Yeah, it's funny how sometimes just a little different industry can almost be relaxing at times, right?
It is, yeah, I totally agree. It's very relaxing.
Yeah, that's fantastic. Well, we'll have to watch for some of her art.
Yeah,
That's
please
for sure.
do
Yeah,
anytime.
yeah. So, Frank, advanced medical balloons is really tackling some of the biggest challenges in medical balloon technology. I'm wondering if you can share the story of how AMB was founded and what sets your company apart. Can you provide us some insights there?
Of course, yeah. Thanks, Tom. Well, look, I've been in catheters for the last 15 years, and to be honest, I've always been frustrated that the catheter environment, especially on the ICU, is very, very outdated and and very low tech and low innovation. So I believe A and B is tackling one of the greatest hygienic issues on the ICU. I mean, while you and I speak, about 30% of highly traumatized ICU patients lie in their feces multiple times a day. I mean, those are cardiovascular, neurological, or general trauma patients, and stool in the bed is not good. It's a bad problem, and it's not solved properly. Right? So it requires inefficient cleaning episodes by ICU nurses and staff, and they're under huge pressure. But on top of that, it creates severe medical and clinical issues. For example, the spread of C. diff infections or perianal skin breakdown, pressure ulcers like the cubitus, right, which can lead into sepsis and low patient mobility. And if you think about it, there's massive cost. The average stay on the ICU between 3.5 and 4 days generates cost between 50 and 60 grand, right? So a few hours earlier discharge from the ICU means significant financial benefits. Now the challenge is the first generation silicon fecal catheters just don't work. They always leak in over 70% of time. And actually, I myself, over the past 15 years, was instrumental in building this business. But then I got to know advanced medical balloons. And we have proven in a clinical trial with the University of Heidelberg that our technology and the product seals in 90% over time. So we prevent infections. Now, AMB was founded by an intensivist who originally focused on respiratory indications and then moved into fecal. And the underlying technology of the company is we take an off the shelf polyurethane catheter, not silicon, not PVC, polyurethane, and blow or form that into an ultra thin balloon. And then that balloon gets assembled into an ICU catheter. Now, the massive advantage here is that those very ultra thin balloons are low pressure balloons. They're filled with air and not with water and don't apply any pressure to the rectal mucosa. So the first product we have in the market is a rectal catheter called High-Tech for the management of liquid stool on the ICU, and we have shown significant clinical superiority in terms of leakage and a total improvement in medical and clinical conditions. So no stool in the bed changes everything.
Yeah, I can see that. And with that, just are you doing activity as a OEM, or are you working on your own brand of product as you move forward?
Yeah, so the original idea was that this technology can go beyond and can go into other indications, even outside of the ICU. Now, I helped the company raise funds and then joined as the CEO 4 years ago. And basically, my decision was always we go after our own products, our own brands. We have then focused the company on ICU only and have a few OEM projects, but very, very small. And ultimately, over time, we will purely focus on our own products to be sold.
Yeah, yeah, gotcha. So, Frank, building on that a little bit, medical balloons are used really in a wide range of applications. From minimally invasive surgery to diagnostics. So, I'm wondering, as you look at this, where do you see some of the biggest opportunities for innovations? Can you provide us any insights with that?
Sure, sure. So yeah, as I just said, we actually focused on the ICU, right? And as I said, the fecal space actually, leakage is everything. So you don't want stool to end up in the bed. But the reality is that kind of problem is in other indications as well, especially in the space of ventilation on the ICU when it comes down to endotracheal tubes, right? And there hasn't been any innovation for the last 50 plus years. And most of the catheters are totally commoditized. So we are actually going into the ventilation space. And as an example, when the patient is under ventilation, most of the endotracheal tubes, they're made of PVC and they don't seal, in a breast-to-breast ventilation status. And our future product actually will be capable to seal the trachea and avoid the aspiration of fluid into the lungs, which, while we speak, 50% of the mortality on the ICU comes down to ventilation-associated pneumonia, or VAPS as they're called, and actually people die from that. And it's frustrating that there's no solution to that, but our technology in the end will actually be able to disrupt this market and change that.
Oh, that sounds really exciting. So, when we're talking, you mentioned, some of the outcome studies that you've been working with. I think it was at the University of Heidelberg.
Right.
So, yeah, your technology, enhances the precision and performance in some of these critical procedures. I wonder if we can build on that a little bit. Can you share a specific example of how your innovations are improving patient outcomes?
Yeah, of course. Well, as I said, if you go back to the fecal market, no stool in the bed changes everything. If you think about it, these patients lie without a catheter, even with a silicone catheter, between 8, 10, 12 times in their own feces and need to be changed and cleaned completely, right? So think about it. First of all, it reduces the burden on staff. This is an endless, unpredictable cleaning of severely ill patients, and it's a massive undertaking. It requires 1 to 2 nurses, 20, 30 minutes work. So no stool means everything to those nurses and clinicians, right? But secondly, of course, there is massive medical issues with stool around the skin. If you think about, a lot of these patients develop any kind of perianal skin breakdown, any kind of pressure ulcer. And if stool comes around the pressure ulcer, we've seen a lot of decubity, we've seen a lot of sepsis happening. Of course, we've seen a lot of spread of diseases like C. diff around the wards. And that all goes away if there's no stool in the bed. And then, finally, if you think about it, you mobilize patients earlier, right? I have seen cardiovascular patients walking around with a high-tech product in place, and you can think about, dignity around patients lying in their feces. No stool in the bed. We give the dignity back to patients. We give the dignity back to family members, caregivers, nurses. So I think there's massive outcome and positive development for patients in that environment.
Yeah, that has to be very gratifying for you and your team to be working in that area, to be sure. Yeah. And then, Frank, one of the biggest challenges that I hear about talking to many of the innovators that I speak to these days is the challenges for medtech companies in gaining access to hospitals. I'm wondering what kind of barriers that you and your team are running into, and how are you overcoming them?
Yeah, thanks. It's a great question. There is no doubt that the hospital environment has changed in recent years, right? So especially post-COVID, bureaucracy has significantly increased, and pressure on staff and on cost has significantly increased as well, right? So first of all, and that's one reason why we focused on the ICU predominantly, because despite all that pressure, despite all of those issues, the ICU is a life-saving environment, right? And I've experienced over the years that they're always open for new technology, for new products. Second of all, when you look at the catheter space, clinicians, nurses have accepted the low performance of catheters, especially in the fecal environment, especially those first generation products, they just don't work. And clinicians and nurses have accepted that only a fraction of patients are treated because they leak anyway, and it defeats the object. You put something in to contain feces, and then they leak into the bed anyway, right? So whenever we're speaking to nurses and doctors about fecal catheters, we always get the same response. They don't work, they leak all the time, right? And that's why we only use them in a fraction of cases. And then we tell them, we promise them high-tech and A and B is going to change that, right? And that always opens doors, and we get all the stakeholders involved. We can talk about this, and I would say mostly this ends up in an evaluation, and I think that's always key, right? You want customers to try to see your product in action, and once, I would always call it, once they create their own evidence, right? most of these evaluations end up in a discussion about conversions. We haven't seen any disappointment about a trial with the high-tech product. And then lastly, I would say, do good things and talk about this. Create advocates and KOLs in the accounts, speak about the good things, speak about the changes, create data locally, not only bring them from outside, from clinical work, but also create internal data, prove them that there is a massive improvement, on the staff, on clinicians and nurses, but there's big outcome improvements for patients overall. And Germany we have become market leader in the German market in fecal management. So people talk about that, and you can't look away. You have to go after this.
Yeah, that's really helpful. And diving into that a little deeper, you touched on, that KOL engagement and some of those local, studies. So I'd like to learn a little bit more about that clinical engagement when introducing the technology. A lot of our gurus out there are entrepreneurs or soon to be entrepreneurs. So what have you learned about working with these healthcare providers to drive acceptance, and maybe what best practices, especially in local markets, have you started to build on? Can you provide us any help with that?
Sure, yeah. Well, I think overall, Tom, I think clinicians are mostly very interested in new technologies and innovation. So I would always say, even if life in hospital has become more complex and the balance between outcome and economics, is become a much more important criteria for the adoption of products and technology. I'm a big believer that there's always a place for innovation and great products. And if you change people's lives, whether it's clinicians or nurses or it's the patients, I think they're always open, and they want to adopt new technology. I mean, on the ICU, we have learned that, the clinicians and the nurses work very closely together, right? And that we have high engagement from the nurses to improve their everyday life, right? Speaking about all those cleaning episodes, to take them away is a massive improvement for the nurses. So clinicians understand that, because in the end, that has massive impact on the patient outcome as well, right? So the clinicians support that. We have to involve them in the decision making, even if catheters is more a nurse-driven environment. Get the clinicians involved. We show them the differences we can make, especially when you think about decubity and the follow-up cost and complications. If you think about Clostridium difficile infection spread around wards, and if you think in the future about ventilation-associated pneumonia, we can prevent that, and we can prevent the mortality that comes from that. So, I think that goes a long way. Now, I think at the same time, just to add a bit more color to this, you always have to have a realistic and respectful discussion between outcome and cost and price of the material, right? And we engage payers early on, right? So we always get the nurses, they do the everyday work on the catheters, the clinicians, they overlook the patient treatment, and of course the purchasers and payers involved as well, to get them into the boat early, to let them experience the massive advantages the product and technology brings. And once they understand that, it builds trust, it builds a partnership relationship. We have experienced that over time, there's an acceptance of higher pricing, and I can tell you, we sell for a 50% premium over the competition, and have become market leader in a market like Germany. So over time it tells that they accept, if the benefits are there, the innovation is there, there's the pull from the nurses and clinicians. Eventually they adopt the product.
Yeah, I love that you brought up the outcome versus cost, right? Because in the US anymore, things are so value driven, right?
Yes,
Which I
sure.
think is appropriate, right? So getting that information and really being able to look at what those costs are for some of those issues with C. diff, some of those issues with wound care. I would think that your team is really zeroing in on the cost savings and cost prevention. Am I heading down the right track with that?
No, you're absolutely right. And look, I'm a big fan of individual account, experience and learnings. And we have started, we actually work on that economical outcome account by account. And we basically have a deep discussion with them. So what's the cost, not only associated with the material, but also with the treatment? What's the additional cost? How can we compare that, right? And once you start creating individual, experience and evidence per account, give an example, the C. diff spread and other bacteria spread across ICU wards is well tracked in the US. There's a good understanding, and we openly talk about this. What's the accrued cost? What's the implemented cost? To overcome this, and then we build case-to-case individual decision papers for all of the stakeholders, to basically understand the additional cost and then adapt the product and what it takes. Yes.
Yeah, yeah, that's very helpful. And Frank, I'm going to shift the conversation just a little bit here because AMB has really a strong focus on innovation, as you kind of touched on earlier. And as I mentioned, a lot of our gurus out there are building their companies. And I'm wondering how you and your team foster this culture of innovation and creativity and problem solving with your team. Can you provide us any insights there, best practices?
Yeah, thanks. Yeah, I guess so. First of all, I would say, I always call this you paint a bigger picture, you paint the cathedral, right, where people are going after what they want to build. And I guess we want to make the lives of patients and clinicians and nurses on the ICU better. That's the overarching rethinking critical care, right? I honestly believe, and we as a company believe, it's unacceptable that catheters are so outdated in an environment like the ICU that's so technologically advanced, right? How can it be that in the 21st century, on these highly technologically driven ICU wards and hospitals, patients are lying, highly severely traumatized patients are still lying in their own feces every day, right? And patients die from infections where we know the root cause, right? So this needs to change. And if you think about it, I actually think that's a pretty damn good purpose for an organization to be motivated to keep moving, right? Now, at the same time, Tom, we're a small company, right? So while and it's always funny when I speak also to investors and shareholders about this, right? We're a MedTech, so we have to have all required functions as a MedTech firm. And don't forget, we are fully MDR and FDA certified. So we have lots of overlap and close communication in the organization. I mean, there has to be constant dialogue, between R&D, production, the back office, sales. Those are all small departments in itself, but together we quite a nice organization. It's a constant exchange. It's learning from each other. It's listening to customers. And look, I must say, I've got a personal mantra. I'm always focused that everyone in the organization understands each other, understands the customers, understands what we're doing there, what are we delivering, why we do this every day, what's the purpose of the company to make those lives of patients and clinicians and nurses better, to get stool out of the bed, reduce infection spread, reduce peri-in skin breakdown, and the impact you make. And I think once they understand that fosters a lot of positive culture, gives purpose, and and it also engages everyone to be better, to grow faster and become a better company.
Yeah, I love the personal mantra and the communication. And I'm thinking that some of that focus on that patient helps with some of those debates, right? And maybe helps people check their egos at the door so we can get
Yeah.
to the right solution. Is that what you're finding?
No, I totally agree. Yeah, I totally agree. I mean, a small company has very little room for ego. And I don't mean it doesn't exist, so it exists, and that's okay, right? So you
Mhm.
want to look for the best people possible with the least ego, possible. So it's always a bit of a balance in between. But yeah, you're right. Sure. I mean, it's a common goal to achieve this together, and you have to help each other every day. That's right. Yeah.
Yeah, I love that. And then, balancing that R&D, with commercialization, I think can be difficult. We always hear about the shiny object out there, right? So, how do you ensure with your team that that innovation pipeline aligns with real world clinical needs? Do you have any
Yeah.
thoughts there?
Yeah, no, that's a great question. So first of all, I think it's you have to be in the market and you have to generate revenue and you have to sell, right? So commercialization is important, right? Because it doesn't help if you're not out there and you create a business. At the same time, we focused the company on transforming catheters on the ICU, especially in fecal, in respiratory, and potentially urinary in the future as well. Now, I must admit, we were very fortunate to find an R&D, R&D experts that have a long track record in the catheter space, understand the technology very well. At the same time, we engage the sales organization as much as we can, but we also engage KOLs and clinicians into constant dialogue and communication. I always make sure, as I said before, my leadership team in the next level down has contacts to customers, is out in the market, attends conferences, attends KOL meetings we have where we bring people together and speak about the needs of the patients and the clinicians, right? And as I said, I want people to go out into the field, understand, what's happening today and how are the accounts moving forward, what's happening in the future. And I think, that helps to learn on a regular basis, to understand, but also understand the status quo and challenge the status quo. And with that, bring the right information into R&D. And finally, I think, it's always important, you probably not always aim for the perfect final, achievement. You have to do this while you go, and you do small steps on the go, to improve your product, and to engage further customer insights. So I think it's more a stepwise approach than go the full way in once, right? If that makes any sense.
Yeah, it does. And I especially like that immersion part, right? Getting in there with the customer and listening to them, right? And getting that back and forth. I think that's really critical important. So thank you for sharing that.
Sure.
So Frank, as mentioned, our gurus out there, are starting their businesses. And I'm just curious with, your experience, what advice do you have for entrepreneurs looking to bring, cutting edge medical technologies to market while maintaining this innovation culture? Do you have any thoughts for us with that?
Sure. Yeah. Thank you, Tom. Well, to be honest with you, that's a very difficult one, and I'm sure there's multiple answers. And I don't think my answer is the only one and it's the right one, but it's probably a bit of caveat here. So, I've raised a significant amount, or we as a company have raised a significant amount of money over the last 4 years, right? So, as a small company, you have to turn this into revenue and into success. So let me say, given there's a market and there's demand for the to be developed product, or for the developed product, there's a process and a product, especially in the MedTech environment, that's sound, robust, and safe. So let's say that's all forgiven. I would say, that's all a given for your audience out there. I would say speed to market is absolutely critical. Get the product into the customer's hand. Start generating experience, learn from that, and start generating revenue. Because in the end, that's what always keeps you going. I would also say, learn from the customer, from their feedback, from the experience, right? Take those learnings and translate them into your R&D development, into your production, right? And develop the product further. Yeah, and I would always say, nothing is more motivational for a young organization than success, right? If you start converting the first large account, imagine that, right? When we converted the first big university teaching hospital, that's massive, massive motivation, right? Because A is you can show the product works. B, you can show you can do it, right? It can be done. You can convert and evaluate an account. I think a growing business, makes a difference. It injects energy and purpose into the organization to work harder, to become better and better. And then if you celebrate those successes and learnings, to stay focused, there's always a lot can be done, right? You started out and saying, those catheters, those balloons can be used in multiple indications. And you're right, we could go anywhere, right? And you asked an OEM, yeah, you could go anywhere. As a company, you have to stay focused, identify 1, 2, 3 target areas and then go after them, generate revenue, generate proof of concept, get the motivation back to the organization. I think that makes a massive impact.
Yeah, that's really helpful. And I've got a little follow-up to that. I may put you a little bit on the spot here, but I'm listening to you with that speed to market concept, and I'm thinking, you talked about raising money, right? So with that speed to market, are you finding that helps with credibility with investors, so you can get a little more from those investors, or get networked into the community a little deeper?
Yeah, yes. So the answer is yes. I could full stop that and say, yeah, yes. There's nothing more credibility than a customer saying the product is great, I love it, and I convert it, because this makes a difference to the patient's daily life and my staff and nurses. So yeah, you're absolutely right. Now, again, this is a very, it's a difficult question. We've raised a lot of money over the last 4 years, and I would say, as I said, I think if there's a market, an attractive market environment that has opportunity to grow and to expand, if there's a product that's proven that it works, it has a differentiation, it's certain uniqueness, and you have shown you can do it. It can be done, right? Because sometimes there's a market, and sometimes you get a great product, but you don't get it in the customer's hand, and it probably takes too long to transfer it into revenue. I think if you can show all of them and you can show it can be done, yeah, of course, that gives a lot of credibility in conversations with potential investors. So absolutely.
Yeah, fantastic. So, Frank, this seems like a really exciting time for you and your team at Advanced Medical Balloons. What does the future hold? Where are you going from here? Can you give us any insights for that?
Yeah, absolutely. Yeah, thank you. I mean, I come back to your previous question. It's in the end, it's all about growth and driving revenue and driving share. Sure, that's the environment in the smaller organization and in the bigger organization as well. I mean, we achieved market leadership in Germany in the fecal market. We see good first momentum in the US. So we will continue to build on that. We will continue to learn. We've just launched our second portfolio product in the fecal space, an odor reduced solution, which is a nice addition to the portfolio. And of course, then we go beyond into the respiratory catheter. We've just frozen the design, and we have a first idea how the product will look like. So we'll go into the respiratory indication. I would also say the fecal market is a fascinating market, right? It has been underpenetrated for the last 15 years. If I said 30% of patients suffer from liquid stool, probably only 8 to 10% are really treated with the product. So there's a massive market segment that has not been penetrated, simply because the first generation silicone products just didn't work. And we have shown our product high-tech actually does work. So I believe there's an expanding market. We can disrupt with our technology. The competition is outdated. This market is attractive for investors, for strategic players, and I believe A&B is very well positioned. We're commercial. We've shown it can be done. We've converted big, large teaching accounts. We've taken big share in hospitals. We've shown in Germany what can be done in a very, highly, difficult hospital market like Germany is. So I'm very positive for the future, and I'm, positive for what lies ahead of us.
Oh, that's fantastic. It does sound like a very exciting time for you and your team. So, Frank, first of all, I want to acknowledge and thank you for the time that you took in preparation and to be our guru today. If somebody wants to learn more about A&B or connect with you, what's the best way? Is there a website, or are you on LinkedIn? How do we learn more?
Yeah, of course. Yeah. So first of all, there is a website for the company, which is amb-medtech.com, and actually the tech without an H, so it's a tec.com. Yes, so their website. Of course, we get a LinkedIn profile. Just type in A&B Advanced Medical Balloons into LinkedIn, and you'll find the company page. Of course, there is an email, info@amb-medtech.com, and myself, I'm Frank Gehres. You can find me on LinkedIn. Of course, through me, you can connect with the company as well.
Oh, that's fantastic. So, Frank, once again, thank you so much for your time and information. We really appreciated your insights and being our guru today.
It was a pleasure, Tom. Thank you very much for having me. It was an honor to be on your show, and thanks a lot.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048 at gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.